fractures are extremely common. A fracture is also called a broken bone. You may have heard it spoken of each way. What that means is the bone itself that comprises the ankle has a crack in it. Sometimes it'll happen with direct impact, such as a player being hit right at the ankle, for instance, in soccer or football. When a bone breaks, it typically needs to be repaired or fixed. The way we do that is we will actually make a surgical approach to that bone and then put the bone in its anatomic position. That's called a reduction. And then we place metal on it, plates and screws usually, to hold it in place, and then the body can heal it in the correct position. It is very important to get an ankle fracture fixed perfectly, and it's also very important to make sure that the ligamentous or the soft tissue injuries associated with the ankle fracture are not missed, neglected, or undertreated. Too often I've seen patients 10 years after ankle fracture surgery with a completely dissociated and arthritic ankle because the syndesmosis was neglected. That's an important ligament between the fibula or outside ankle bone and the tibia or inside ankle bone. So it's very important that you seek somebody that is highly trained to treat ankle fractures and is well aware of the anatomy and the specific biomechanical function of the ankle. After you've had your ankle fracture and you've had your surgery, the rehabilitation is probably, if not as important as a surgery, probably more important. If you do not get good physical therapy after ankle fracture surgery, oftentimes your outcomes are just as bad as they would be if you never got it fixed. So we highly recommend strong, good rehabilitation after ankle fracture surgery. Ankle fractures are very painful, they're very common, and they can really impede your life in terms of work and school. But if they're fixed appropriately, oftentimes you can get back to work and school within 4 to 6 weeks. It's particularly if they're fixed perfectly anatomically with the appropriate implants that allow early weight bearing, which is what we try to do here.